this exam, I'm going to be performing the abdominal inspection. So I'm going to ask my patient to show us her abdomen. We're going to first look and inspect. Everything looks normal. She has flat stomach. Once we've looked, the next part we're going to listen because we don't want to mess up the bowel sounds. So I'm going to listen in each quadrant. I'm going to start in the right quadrant. And listen to all four. There's 4 quadrants. This is the left upper, and the last one's the left lower quadrant. And I just hear some gargling sounds, which is normal. Once I've listened, I'm going to palpate and feel her abdomen in all 4 quadrants. So we're just kind of, I'm not doing like a deep palpation, but just kind of feeling, making sure she doesn't have any tender or swollen areas or something that would kind of indicate she would maybe need further testing in a certain area. Does everything feel okay?
Mm-hmm.
Okay. So now that I've palpated. Next, I'm going to listen to some of the different organs down here. I'm going to first listen. She has her aorta that runs up the stomach. I'm going to listen with my bell, but I'm going to see if I can kind of listen to that area. And then I am going to listen to the left and right renal arteries. And then we're going to do her left and right iliac arteries. And then her femoral arteries, which is be a little bit further down, but try to listen to those. Okay. I'm also going to percuss. With the stomach, you should hear like a tympanic sound, which is normal, like a drum. And hers sounds normal. The last thing I'm going to do is show how to palpate the liver border. There's 2 different techniques. The first one, I'm going to put my left hand underneath her back and feel for the edge of her rib cage at the very bottom. And ask her to take a deep breath in. I'm just going to kind of feel inside here, along underneath the line, and I can feel the edge of her liver. The other technique is called the hooking technique, so I'm going to stand kind of further up and ask her to take another deep breath, and you kind of hook your fingers underneath, and you can feel the edge of the liver, which I can. And that is all for this exam.